moving towards another important property, which is actually thickness of cementum. So let's start it. Bismillahirrahmanirrahim. So they are saying that deposition of cementum is actually a continuous process, and it is varying rate is throughout the life, but it is actually a continuous process. It is actually most rapid in the apex area, means in the apex it more rapidly deposit due to because of the tooth eruption to compensate, and also for the etrosion itself it has to compensate. Now in the coronal area of root varies from 16 to 60 micrometer, which is about thickness of a hair, but it has a greater thickness at the apical third and also in the furcation area. It is more thicker in the distal areas than the mesial areas because of their functional stimulation from the mesial draft over the time. In 11 to 70 years, the average thickness of cementum increased 3 times, with the greatest increase seen in the apex area. Means during their 11 to 70 years, the average thickness increases 3 times in the apex area. 95 micrometer average at the age of 20 and 215 micrometer at the age of 60 has been reported. Abnormalities in the thickness of cementum, like it can have the absence or parasity of the cellular cementum, means either it is the cemental aplasia or hypoplasia, or excessive deposition of cementum like the cemental hyperplasia or hypercementosis. Hypercementosis is actually a very prominent thickening of cementum which is related to age related, mean it happens with the time with the age. It either can be localized to one tooth or generalized to entire dentition. It can be a physiologic variation in the thickness of cementum among different teeth of the same person, but it is very hard to distinguish or difference between hypercementosis and physiologic thickening of cementum in sometimes. Nevertheless, but proliferation of the excessive cementum that has a broad spectrum, like it occurs either in a neoplastic or non-neoplastic conditions, like you have benign cementoblastoma, cementifying fibroma, periapical cemental dysplasia, fluoride cementooseous dysplasia, other benign fibroosseous lesions. It has the hypercementosis. It does not require any treatment, and it could possess a problem if an affected tooth requires extraction, means it can create a problem during extraction. So what happen then we do in a multi-rooted tooth, a sectioning of tooth may be required after before extraction, means you make multiple sections, then you extract the tooth actually. Okay, so here we have discussed the thickness, that how the thickness is basically because it is a continuous process throughout the life, it is deposited. Okay, it either compensate the tooth eruption or etrosion. It has there is more thickness in the apex area than the coronal area. There is more thickness is mesial in the distal areas than in mesial, and it has between the age of 11 to 70, the average thickness increases 3 times in the apex area. Okay, there might be abnormalities like cementum aplasia or either hypercementosis. Hypercementosis is age related, either it can be localized, generalized. It is very hard to differentiate between the normal physiologic variation and hypercementosis. Hypercementosis basically occurs in the neoplastic conditions like benign cementoblastoma or periapical cementum dysplasia, etc. It does not require any treatment, but unless when tooth is affected and you require extraction, so you do multiple sectioning of tooth before the extraction.